Hi, I'm Nikita. I'm one of the exercise physiologists for the Knowsley Community Cardiovascular Service. Today we're going to talk about exercise and physical activity and the importance of it in your cardiac rehab program. So today I'd like to talk about some of the benefits that exercise provides us with, and the importance of the exercise testing and why we actually complete a functional capacity test, understand the principles of exercise, which is the FIT principle, and how we're going to exercise safely but ensure it's effective also. We'll also touch a little bit on the life after cardiac rehab and how we can make exercise and physical activity a long-term change. First of all, is there actually a difference between physical activity and exercise? So yes, there is a difference. So physical activity is any skeletal bodily movement that increases energy expenditure. So this is considered any activities in your daily living, so things like gardening, shopping, brushing your teeth, anything that's getting the body physically moving. It's classed as our daily activities and the most common of the two, as it becomes quite natural to get up, move and be functional in our day-to-day lives. Exercise, however, is planned, structured and repetitive. So it's a targeted activity where you have goals in place aiming to improve things like fitness or functional capacity. So exercise sessions tend to be quite organised, they're intentional, and this could be examples such as gym sessions, participating in regular sports, biking, swimming, any kind of sport that you have intentionally set out to achieve. So for example, engaging in the cardiac rehab program, the set exercise sessions or circuit sessions or gym sessions that we put in place. So although they're both different, both are still equally important for improving our cardiovascular health. It just seems that one might be a little bit easier than the other. Our goal in cardiac rehab is to get you involved in both physical activity and exercise to improve the overall outcome and recovery of health, specifically for secondary prevention. And so, what actually counts as exercise? And how much should I be doing? When you come to participate in the exercise classes, you'll have completed a functional capacity test. Now that's either on a cycle or it's usually a walk test. So when we do these functional capacity tests, this allows us to test the responses under a little bit of stimulus, so some stress in the form of exercise. It allows us to measure the hemodynamic responses, so we look at your blood pressure, your heart rate and how your oxygen levels are responding, and each level have a little bit of an increment and increase in intensity based on your own individual exertion levels. We take into account previous training, as well as medications, other comorbidities such as diabetes, COPD, hypertension, so any other risk factors are also involved in the decision-making process. What's also considered is any musculoskeletal issues or imbalances or joint problems that could affect the way you exercise. We need to know this information so we're able to prescribe safe and effective exercise and also individual programs that suit your own goals. A typical outcome measure is our MET value, which is used to estimate the expenditure. So the expenditure of energy, and it's commonly graded based on different physical actions. It looks at the oxygen that is consumed per kilogram of weight, and at rest, that level is 1 MET. So that is just enough of the energy expenditure that your body needs for just existing. As we increase our activity levels or increase our exercise, that MET value increases in relation to the intensity. So as we find out your initial score, so your baseline from your functional capacity test, towards the end of the rehabilitation, you're likely to repeat that test again, and hopefully there'll be an increase in exercise tolerance and exercise capacity, and therefore an increase in your MET value. What's worth noting here is for every increase in 1 MET, so if you started at 3 METs and finished the program at 4 METs, we see a decrease in 12.5% of all-cause mortality, and that's with an increase in 1 MET. So of course, the higher METs that you increase, the lower the chances of all-cause mortality. And in order to increase your METs, participating in regular activity will help to improve that cardiorespiratory fitness. So the benefits of exercising includes a lot of physical and mental benefits. So if we focus more on the physical aspects, it improves our physical capacity. So our general cardiorespiratory fitness, it strengthens the heart muscle and helps lower the blood pressure and also lower our resting heart rate. So our heart is beating efficiently and we're able to recover a little bit quicker. It helps reduce the risk of developing diabetes, so reducing the blood sugar levels, which exercise is renowned for reducing. This is why usually if you have a new diagnosis of diabetes, it can be reversible with dietary and exercise interventions. So participating in regular physical activity, certainly if you do have diabetes, is going to help for reducing those blood sugar levels. It helps improve our lipid profile and slows the progress of existing cardiovascular disease. So hence cardiac rehab being put in place as a secondary prevention. So we know the medical aspect of rehab and the therapy and titration, as well as the exercise component, does help improve the chances that there won't be a secondary event. And by this, it helps us provide a longer and better quality of life. It generally reduces unplanned hospital admissions by up to 28% and improves our quality of life and functional capacity. It helps strengthen our bones and build our muscles, making it easier to be more functional in our normal daily activities. It can also help reduce body fat. Regular exercise also helps strengthen our lung function and does undoubtedly increase our lifespan. So they're just some of the physical benefits of exercise, but what about the mental benefits of exercise? So when we talk about physical activity or exercise, we often associate the benefits which are physical, so reducing body fat, increasing bone health, increasing our heart health, but what about the actual effects on our mental health? So there are countless studies available that do show a correlation between participating in exercise or activity and that having a positive impact on our mental health and mental well-being. So studies have shown that participants actually feel more content, more awake, and calmer after being physically active compared to periods of inactivity. So if you've been sedentary for quite a while, if you participate in a little bit of activity, that actually has shown that you do feel things of being more awake and calmer and quite alert. So it does tend to give you that boost of energy or that boost of life after doing a little bit of activity. So this is commonly known as a feel-good factor, or you might hear people say a running high for the runners out there. But what do they actually mean when they say a feel-good factor? So this actually relates to the hormones that are produced when we exercise or participate in physical activity. So the main hormone is the endorphins, and you might hear this said quite a lot when it comes to exercise, but an endorphin is a type of neurotransmitter or chemical messenger in the brain, and this is actually associated with helping relieve pain or stress, which is a huge factor when it comes to poor mental health. And endorphins are only one of the many neurotransmitters that are released in exercise. And physical activity itself also stimulates the release of dopamine, norepinephrine and serotonin, which are also contributory to the increase in mood and the impact of how this is regulated. So this is where you tend to have the feel-good factor after you participate in exercise. Not only does this help with brain health and contribute to regulating your mood, it has also been clinically proven that physical activity is used as a standalone treatment to help for things like clinical depression or anxiety. So usually it's used as a combination therapy with medication or psychological therapy, but exercise itself can be used as a treatment for depression. Physical activity has also been identified as a protective factor in studies that examined the risk with patients who have suffered from dementia. So it actually has a protective factor that helps lower the risk of the onset of developing dementia. And finally, we tend to find that after we've participated in some activity, that we do feel good in ourselves. So our own self-worth and perception does actually increase with a little bit of exercise. So it's not actually just the physical benefits of exercise, but it has a huge benefit for our mental well-being. It's certainly worth participating in some kind of activity, whether that's physical activity or exercise, because you get a combination of the two. You have improved physical health and also improved mental health. So it's a win-win situation, really. So we all know that exercise is good for us, but what are the statistics? So NHS England in 2018 did release some evidence of the effects of regular activity and how that lowers the risk with different diseases, cancers, and also how it impacts our risk of death. And so particularly premature death, which is lowered at around 30% if we participate regularly in physical activity. It also touches on a huge 50% lower risk of diabetes and colon cancer. It's associated with about a third of lower risk of depression and dementia, and also, as mentioned, 30% lower risk in premature death. If we look just slightly increased there, so at 35%, that's much of a lower risk of coronary heart disease and stroke. And on the higher end there, we have 83% lower risk of osteoarthritis and 68% lower risk of hip fractures, which will contribute there to the 30% lower risk of falls, which may be common among the older adults. It's also worth noting for women, there's up to a 20% lower risk of breast cancer. So just as a snapshot, we can see that actually participating in regular exercise or physical activity has a huge impact on lowering our risk profile and ultimately increasing our quality of life. But not just quality, but lifespan itself. So cardiac rehab isn't a one-size-fits-all approach. So the types of exercise will vary from person to person. It's also mainly about enjoyment. So choosing an activity and a mode of exercise that suits you is much more likely to make you stick to a program and keep more motivated. So when you're looking at types of activity, the two main types you'll see when we do our exercise rehab classes are cardiovascular training and strength training. So common cardiovascular or cardio exercises include things like circuit training, walking, cycling, or some gym-based activities. So that could be the cross trainer or the rower, or obviously the recumbent bikes. And in the circuit classes, usually things with the box steps or shuttle walks. So this is concentrating more on your heart as a muscle. So as we know, it is a muscle, and just like your biceps or your quadriceps, it needs to be worked. And the most efficient way to do this is to participate in some cardio, which is also known as aerobic activity. Aerobic exercise utilises large muscle groups in a rhythmic manner, so it's recommended. It's usually a continuous or interval approach and tends to be performed as a main part of an exercise program. However, what shouldn't be overlooked is the resistance and strength-based work. So guidance tells us we should try and work towards 2 to 3 times of strength-based exercises a week. And for muscle strength and endurance exercises, these are anything that provides a resistance. So that's usually training with weights, which could be in a circuit class with the dumbbells or resistance bands, or going into a gym and using either the free weight machines or some of the functional areas with the kettlebells, barbells, and other functional equipment. Resistance training is associated with enhancement and maintenance of muscle strength and power, which overall leads to an improvement in our functional ability. It also helps the stimulation in bone formation and the reduction in bone loss. Resistance training is important because it also has been shown to improve glucose metabolism and reduce blood pressure. Combined with aerobic, it also helps with the management of weight. So a combination of both cardio and resistance work is a great start towards an exercise program. However, if it's not something that is suitable or enjoyed by you, then you can choose other things such as recreational sports, which you may be more motivated to compete in. We should also consider balance, coordination, and our own flexibility, which is often challenged when we're doing exercises. The main focus is to try and find a type of activity that you enjoy and that you will regularly stick to. So when we're about to do exercise, it's really important that we participate in a warm-up and a cool-down as well. The warm-up should be gradual and progressive, and it's like thinking about when you're driving a car. You don't just go straight to 5th gear. You got to go nice and slowly, work your way up, and it's exactly like that for the body. So we start with some light pulse-raising activities, and this includes some static stretching, which is interspersed with the pulse-raising moves, which is allowing us to maintain our heart rate throughout. The warm-up allows us to mobilise our joints and warm up the large muscle groups that are about to be engaged in the next training session, and also reduces the risk of injuries and prepares the body, so increasing the muscle temperature, the core temperature, and allowing your circulatory system to adjust to some light stress on the body. Once you've finished a warm-up, you should be feeling slightly out of breath. Our muscles should feel a little warmer and feel a bit more mobile than when you were at rest. This usually correlates to the green zone of the RPE, so the warm-up should feel quite nice and light. Once you've progressed from the warm-up, the main conditioning period of your 20 to 60 minutes of activity should feel in that moderate orange zone. After you've finished your exercise, whatever that might be, whether it's the gym or a class or a recreational sport, it is really important to make sure that you do a thorough cool down. So from 5th gear, bringing it right back down to 1st gear, nice and slowly, regulating your breathing, bringing your heart rate back down slowly to where it was at resting. The idea of a cool down is to reduce the risk of hypertension, so your blood pressure dropping too low, and also reducing the risk of any funny rhythms of your heart, as a graded cool down has been found to reduce the incidence of these complications. So the cool down exercise should be the reverse of the warm-up, and as stated, in most respects, the aim is to gradually return, nice and slowly, the cardiorespiratory system near to the resting levels. You can include some stretching for the purpose of improving the flexibility, and they should feel nice and light. You'll see us in the class quite often asking you to keep some movement in the feet, whether that's raising your heels or tapping your toes, which we name as active recovery. So this allows us to flush the blood back up to where we need it, to our vital organs, our lungs, our heart, our chest, and stop it from pooling into the limbs from doing some kind of exercise. So as we're resting, as we're regulating our breathing again, just keeping a little bit of movement in the legs, in the toes, in the feet, and pushing that blood back up to where we need it. You'll know that you cooled down properly by your breathing feeling back to normal, and you feel back to the way you were just before you started the warm-up. When you are stretching, just be mindful of any postural changes. So if you're stretching towards the floor or at the side, to make sure it's nice and gentle and slow, just to reduce any risk of feeling dizzy. And on that note, it's also really important to try and keep hydrated. So after your warm-up, when you're feeling a little bit more breathless, having some water, and also through the main conditioning component, making sure you're adequately hydrated and replacing those electrolytes that you lose during sweating. We usually do the warm-ups together in the rehab classes, but ensure that you do these in your own time at home if you are going to engage in some exercise. This is a key part to making exercise effective, but also making it safe. So we know that exercise does place a stress or a demand on the heart and the body, so it is quite normal to feel quite anxious or a little bit apprehensive when about to engage in some activity. What's important to know is, although activity should be effective, it's also important to be safe. And when we talk about safety, we mainly talk about listening to your body. Obviously, everybody's individual, and of course, you know your body better than we do. So it's important to recognise any triggers or any symptoms or anything new that has developed from engaging in some exercise. But what I want to mainly focus on is that exercise does elicit some natural and normal responses. So things like increased breathlessness, achiness, or where your muscles feel quite tight, and obviously an increased heart rate. So it's about differentiating what is induced by some exercise and any symptoms that you feel are new or worsened by exercise is something to be more mindful of, and of course speak to your healthcare professional, in which our cardiac rehab team will be able to help. A good way to monitor your exertion levels is something called an RPE scale, so rate of perceived exertion, and this is what you'll see when you participate in cardiac rehab. It's an indication, so you let the team know how you're feeling or how you're finding the specific exercises that you're participating in. So when it comes to exertion, it's almost like a scale of effort. So it goes from 6 to 20, 6 being no exertion at all, at rest, so you sat down having a chat, not actually engaged in any kind of activity. And then you can see the zones are split up almost like a traffic light system, green, orange and red. So the warm-up, as discussed earlier, should be around your 8 to 11. So we're moving, we've moved on from rest and we're moving the body slightly, slowly, and warming up our muscles and engaging in some light activity. The main conditioning component after you've completed your warm-up is round about your moderate activity. So that's between sort of 12 to 16, depending on how easy you're finding the exercises. This can be different when we talk about aerobic exercise compared to resistance and strength building exercises, but it's all based on your individual feelings towards the exercise. And beyond that point, we go from 17 onwards in the red zone, where it will get excessive sweating, very high increased heart rate, and likely to call it more towards the maximal exertion. It's a moderate zone, the orange, which is where we would focus our rehab on. So what's important when we're monitoring is working to your own levels. Of course, activity levels are quite individualised, so what works for you and how hard or easy you find something is not necessarily the same as your peers. So it's also important not to compare your exertion to anybody else. We monitor our exertion in the class using the RPE scale, and also we tend to implement some heart rate monitors. So usually that's a chest strap, which goes just under the bust line and works with a magnet that is attached to a wristwatch. And those in combination together will give us an accurate reading of how your heart is responding to some exercise. The more you do, obviously the increase in your heart rate. Another good indication or monitoring system is the talk test. So when we're able to hold a conversation, much like how I'm talking now, and whilst doing some exercise, you'll be able to gauge how intense or how easy or difficult the exercise is. A good way to think about this is if You're moderately breathless, so there can be some pauses. You're talking, but there's some kind of gaps in between. That's usually quite a good level of exertion. If you're unable to complete a sentence and you're struggling with your breathing, as in the demand is much higher, so you're not able to get sentences out, something like that, then the exercise is probably much more of the higher intensity. And we should look at slowly reducing that back towards the moderate zone. If you're able to sing, I'm not going to sing, but if you are able to sing, it means you're probably not working that hard enough yet. So I'd encourage to increase the activity just slightly towards being able to get that moderately breathless that we're looking for. It's important to note as well that we are all human, and some days you will manage more than others, and that's an absolutely normal response. It's also important to consider if you have engaged in regular activity before, or you're an accustomed exerciser, you've been a previous gym user, or you've been part of any kind of recreational sport, that more than likely your body is quite accustomed to that response of exercise. If you are new to activity and you haven't ever engaged in it before, it's really important to slowly build up your tolerance, and that can be worked together through the exercise rehab classes. With ensuring that the exercise is safe, it also needs to be effective, but there are a few considerations before engaging in activity which you'll tend to find is assessed when you do come to the rehab classes in a little handover. So the considerations are, of course, if you're feeling unwell, don't participate in exercise. And like we touched on earlier, if anything is newly induced, or you become quite symptomatic, to stop engaging in exercise and seek advice. Medications play a huge role in our blood work, in our circulatory system, so some of them can have an effect on things like heart rate, for example, the beta blockers. It's also important to make sure you're taking your medication as prescribed, and note that some medications do have side effects that may affect some of your exercises, for example, fatigue or muscle ache. It's again listening to your body and ensuring you're having adequate levels of rest between your exercises. You should also consider the weather. Of course, if it's super hot outside, making sure you're keeping hydrated and replacing those electrolytes lost through sweat. And when we're exercising, our muscles do warm up as well as our sort of muscle temperature and core temperature. So that's why a lot of people like to exercise in the winter as well, because it's a nice way to warm up your body. And a final consideration is if you are expected to exercise with the classes is, of course, ensuring you're not overdoing it. And if you can preemptively know that you're going to participate in the class, then perhaps have a morning off or keep your rest periods around the activity periods so you're not overly burnt out. It's a good idea to keep an activity diary, which we'll touch on a little later, but this can ensure that you are progressing and also making sure you're hitting the targets or the goals that you're wanting to achieve, for example 3 or 5 times a week of exercise. And then you could also mark each exercise using the RPE scale so you know how to monitor each exercise and whether it's a good idea to increase or decrease depending on how you're finding the exertion levels. So to reiterate, exercise should be effective, but it also needs to be safe. So make sure you are listening to your body and in tune with what it's telling you. Principle we like to use when it comes to progressing your exercise is the FIT principle, and all that stands for is frequency, intensity, time and type. So the frequency concentrates on how often you're training or exercising. So obviously as part of the guidelines, at least 3 to 5 times per week is a good aim that you should try and achieve. But of course, if you're quite new to exercise, trying a couple times per week, or just trying to come to the rehab, so once a week, just to get the building blocks, and then you can progress from there. Intensity refers to how hard we're working. So if you recall the RPE scale from the earlier slides, and this is our level of exertion. So from light, somewhat hard, to quite hard. So you'll be able to monitor your intensity and how hard you're finding the exercises through the monitoring system, such as the RPE or the talk test or the training heart rates. The time is obviously the duration, so how long you're going to do the exercises for, whether that's between 20 and 60 minutes, which is a normal conditioning component, and that's not taking into account the warm-up period and the cool-down as well. And finally, you have type, so what kind of exercise that you're doing. So you can exercise in lots of variations, different modes, so aerobic or resistance training, recreational sports. And this is great because it's better to find an activity that you enjoy the most, because you're more likely to be consistent with it and have the right frequency. Quite an easy acronym for you to remember. So always try and start with building the frequency first, and then as part of the progression, you increase in this slightly. So if you're going to go twice a week, then build it up to 3 times a week, 4 times a week, and slowly working towards your fitness goals. When we're looking at progressing our exercises, after we become quite complacent, or we're finding the exercises quite manageable and remaining in the light range of the RPE scale, we focus on increasing the frequency first. So if you're managing a couple of sessions a week, try and increase that to up to 5 times a week. Then we'll have a look at the duration. So if you're managing, for example, 2 15-minute walks, and then progress onto 3 or 4 times of the same 15 minutes walk and still feel that it's quite manageable, we can start to increase the duration up towards 20 to 30 minutes of that moderate activity. If towards the end you're able to achieve the 30 minutes 5 days a week and it feels quite comfortable, we can then further move up the ladder and start to look at the intensity of the exercise. So that could be increasing the pace, if it's running on a treadmill or running outdoors, or if we look in a circuit-based setting, so if we're using box steps, increasing the height of those, so it's requiring a little bit more work as opposed to a smaller surface and height. Or for example, if you're used to cycling, you could increase the gear or maintaining a higher RPM, revolutions per minute. And then when it comes to resistance training, it's working the selected muscle group to fatigue within 10 to 15 repetitions. It's important to choose a weight which is individualised to your own strength, and towards the end of that set, your muscles should be feeling that fatigue and that moderately exerted feeling, which should correlate to the orange zone on the RPE. Again, for increasing intensity for this, we can increase the weight, but it's important to make sure that you have the correct technique and the correct form before increasing any weight. This will be shown in your cardiac rehab classes and demonstrated by the physiologist, just to ensure that we reduce any risk of injury and make sure, of course, your muscles are adequately warmed up before participating in any kind of exercises. Once you've reached a level that's suitable for yourself and you're happy with the training that you're doing consistently and effectively, the final stage is about maintenance. So this ensures that we're doing this consistently over a longer period of time. So although cardiac rehab is only a short period of time, we'd hope that after you'd finished, that you would continue to implement these as a long lifestyle change. So rather than a short-term quick fix, it's regularly participating in physical activity and exercise as part of a positive long-term lifetime change. This in itself does take quite a bit of commitment and motivation, but it certainly pays off in the long run. Good way to try and keep track of the exercises that you're doing and ensure that you're meeting the guidance is to keep a activity log or an activity diary. Now you can do this on smartphones now, or you can simply keep a written diary or a log in your phone just to know how often you're exercising, what intensity you're exercising, perhaps using the RPE as a good indication, and how long you're exercising for. This way you'll have a visual reminder, and it's good as a motivational tool as well. It also will allow you to look at gaps and be sure to use the FIT principle to help guide you to increase your progression. Once you're able to track your process, it's easy to see where you're at in terms of achieving the goals. So what we like to do is plan out a goal setting target. So each goal is individual to yourself. For example, a couch to 5k, or being able to go on walks more than you used to, or even getting back to recreational sports, swimming, running, anything individual that you would like to achieve. So the SMART principle is a good way of goal setting that allows us to keep on track and keep focused. So SMART, S is for specific. This refers to setting real numbers and real deadlines, making sure the goals are specific to what you want to achieve. So for example, rather than saying, I want to increase exercise, actually putting a value and a number there and saying, I want to make sure I do 3 lots of 20-minute exercises this week. M is measurable. So making sure that the goal is trackable. So like we discussed earlier, this is a good idea of keeping a physical activity log or a log on your phone, just to make sure you're able to see your progression and track what it is that you have completed or incompleted. A, which stands for attainable. So working towards a goal that is challenging but possible. So it's important to not try and overestimate, but also underestimate at the same time. Which leads nicely onto R, realistic. So be honest with yourself. You know what you're capable of. So knowing that, make sure that the goals that you put in place are realistic and attainable. If they do feel a little bit out of reach, it's likely that you're going to be less motivated to reach them. So starting off quite small and building up is a good way. And finally, T for time. So giving yourself a deadline, it allows you to keep quite focused and reduces the chances of procrastinating. So if you use this whole SMART principle, it tends to be a much more effective way of being able to reach your own individual goals sooner. The term sedentary comes from the Latin seder, which means to sit, and can be defined as sitting or lying down with very low energy expenditure. So in order to try and increase our physical activity, what we want to try and do is reduce our sedentary time. So this includes things like watching television, sitting in the car or using the computer, and generally being sat down and not very active. So the hazards of sitting were actually first highlighted in a study from Jeremy Morris in 1950. So he found that there was a 2-fold increase in the risk of myocardial infarction in London bus drivers compared with active bus conductors. So as bus conductors are usually on their feet, walking down the aisles, the driver obviously remained sedentary, and it was noted just the simple difference in physical activity levels had a 2-fold increase in the risk of a cardiovascular event. So with that being noted, it is really important to try and limit the amount of time that we spend being sedentary, especially if we look at our work schedules. If we know for the 8 or so hours that we're at work, we're usually sat down or in any office or admin roles. Sometimes we don't really notice that we spend an extended period of time seated. So it's just being a little bit more mindful and trying to get up and have regular breaks, stretch the legs, get up and walk or move around, just to try and limit the amount of time that we're spending being inactive. Some simple ways of trying to reduce this is taking the stairs instead of the elevators, or if you're on a bus, getting off a stop earlier and walking the rest of the distance. Even simpler things like through the TV adverts, getting up and having a little walk in between. And even when you're making yourself a brew while the kettle's on. It really is as simple as just getting up out of the chair and moving. And to try and increase this seems a little bit more manageable than if we were proposing exercise sessions. So it's about breaking it down into chunks first and slowly increasing your physical activity. Once you've completed your rehabilitation and have had your discharge appointment, you're likely to have been referred to a programme that we call Activity for Life. So Activity for Life is a 12-week free programme, and it transitions nicely from the phase 3, which is the exercise that you did with us, onto a phase 4 programme. So with this, it gives you membership at your local gym, which is more than likely the gym that you had your initial assessment in. With Activity for Life, it's much more of an independent scheme. So unlike the cardiac rehab side, they don't necessarily check your blood pressure, check your pulse, do all the clinical observations alongside your exercise. You have a consultation with one of the instructors and they will craft a programme that's suitable towards your own goals. It's much more independent and goes off your own time schedule as well. If you wanted the more flexible timetable, you could of course buy the full membership, and if you wanted more of the facilities such as the badminton, tennis, squash courts and the swimming pool, Activity for Life also hold those facilities. So whichever training suits you, again, it's finding that activity that you enjoy and that you're going to stick to. They will receive a referral from us after you've been discharged, and within a couple of weeks they call you and book in for a consultation and induction. And after you've been referred, you'll become a member of the Activity for Life. So that's just one avenue of continuing exercise after cardiac rehab. For us, the most important thing is that you find something that you will be able to consistently enjoy and participate in some kind of regular physical activity or exercise. So if the gym isn't something that you like or not really your cup of tea, you can choose a different exercise as long as you're being active. So if you prefer walking clubs or running clubs, or you prefer golf, bowls, any kind of other recreational activity, then we encourage you to participate in that regularly. On the other hand, if exercise isn't something that you feel that you're regularly able to participate in, I realise people have time and work commitments and family commitments. What we would say is to really try and prioritise the physical activity element. So reducing that sedentary time and trying to be as physically active as possible, working around your lifestyle. Cardiac rehab isn't a one-size-fits-all approach. So take the time, try a few different things out and see what works best for you. So the take-home message. So really it's about instilling the importance of any kind of physical activity and exercise. We've established that there is a bit of a difference, but both of them are equally as important as each other. It's about your own individual goals and capabilities. We know that it's great for our physical health and it's great for our mental health. And more predominantly, it can reduce your risk of major illnesses such as heart disease, strokes, type 2 diabetes, cancers, and it's huge for the secondary prevention. The best part about exercise, as cheesy as it sounds, it is free and it's easy to take and has immediate effect. You don't need to see a GP to get some exercise. A final thought is a discussion around exercise being, if it was a pill or if it was one of your medications that you take every day, it will be one of the most cost-effective drugs ever invented. So the benefits really are endless. So with that being said, as a take-home message, try and increase your physical activity, engage in regular exercise, and if you have any questions about physical activity or exercise, please don't hesitate to ask one of the physiologists in your cardiac rehab team.